Shoulder dislocations are extremely common among young athletes and active duty service members. Very often, these injuries require surgery. And even with surgery, arthritis is often the long-term result. In this video, I discuss long-term arthritis after a shoulder dislocation. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. All right, I think this is one that I don't necessarily understand the pushback. And here's where it is. I just not all that long ago was asked to help with a Nexus letter by a veteran who suffered a traumatic shoulder dislocation during service and then developed arthritis of the shoulder, the glenohumeral joint, the ball and socket joint, and was told that had nothing. He got denied before he was working with me. He got denied service connection, saying that had nothing to do with his shoulder dislocation, which was documented in his service records. And I really could not understand why. And I say that as an orthopedic surgeon that has done tons of surgeries for shoulder dislocations. They very often, especially if you're young, need surgery because they become unstable and the shoulder just dislocates more and more with less trauma. But even with that surgery, especially if you don't have that surgery, but even if you do, down the road, 10, 15, 20, 25 years, the risk of arthritis in that glenohumeral joint, the ball and socket joint, is exceedingly high. And I've seen it in even some of my patients where I did a terrific surgery and 15 years later, they developed arthritis. And I've seen the arthritis in patients that had surgery or didn't have surgery for their shoulder dislocation a long time ago. So it is very, very likely to develop arthritis after a shoulder dislocation. And again, shoulder dislocations much more common among active military personnel than in the general population anyway. And then again, the big risk of a shoulder dislocation is a very, very high incidence of recurrence, meaning a repeat dislocation, especially in an active population, athletes in the military. There's thought that it's over 50%. Some studies show it's over 80% recurrence rate from a primary shoulder dislocation in a young athlete, and that would apply to a military service member. And studies have very, very clearly linked shoulder dislocations and recurrent instability to the development of osteoarthritis, and specifically post-traumatic arthritis. And that osteoarthritis process would start much earlier than you would expect shoulder arthritis from just natural wear and tear. Now, what's going to affect that most is the number of dislocations. The more you have, the more likely arthritis is. The younger you are at the time of that first dislocation, the higher your rate of arthritis. If you had surgery, and if so, how old were you? Were there any limitations in range of motion? Was the rotator cuff torn at the same time? But again, even in the presence of surgery to stabilize the shoulder, the development of osteoarthritis much more likely than somebody that never dislocated their surgery. So as far as somebody that dislocates their shoulder during service, if they develop glenohumeral osteoarthritis, I feel like you could very strongly make a case that that should be a service-connected condition. All right, if you're interested in learning more about the disability claims process, you can get a free copy of an ebook I wrote, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims, and potentially how you can beat those. Just click the link in the description under this video. Make sure to subscribe to this channel. You can click the bell to be notified right up there. You can click the bell to be notified when I release a new video and when I start my Veteran Nexus Letter live shows. All right, if you're interested in a Nexus letter for your injury or condition, you can click the link in the description below this video, learn more about working with me and working with my team. We try to make the process simple, try to make it quick, and I try really hard to help in whatever way I can to give you the best chance of success in your claim. Nexus letter, disability, or DBQ, TDIU, any of that, I try to help you with your claim. Thank you so much for watching, and I look forward to working with you.